Hi, it's counselor and educator and founder of the center, Dr. Greg Jantz. I love to talk about sleep. I used to work in sleep research, and here at the center, a place of hope, we do a lot of what we call sleep studies, kind of like a sleep test. How good is my sleep? And you usually know that, but what's wrong with my sleep? Am I waking up during the night? Do I have sleep apnea? Do I stop breathing? Am I in short stages of my sleep and I'm disrupted? So there's so much that we can learn from a sleep study. It's usually 1 or 2 nights, and we're just taking a look at, okay, what goes on? You see, there is a connection between sleep and post-traumatic stress disorder. And what I'm going to say is from trauma recovery. We can be having hard, difficult dreams and flashbacks and very upsetting nights that obviously don't feel like there's any restorative sleep. And it's the sense that even I might be afraid to even go and try to go to sleep because of what tends to happen. And it's so frightening and so upsetting. But we know there is a connection between sleep and our mental health. And I made a note here to be sure to share sleep's essential for processing emotions and memories. Sleep's essential for processing our emotions and memories. You've probably noticed this. You go to bed really angry or upset, your sleep is not restful, and maybe you notice some dreams that are unpleasant. And then what happens? You wake up, and you do not feel restful, and your mood and emotions all affected. So sleep can help us process emotions, but you don't want to go to bed angry, as we've all done. When we experience trauma, sleep cycles are usually disrupted. So significant loss, emotional abuse, physical abuse, sexual abuse, a sudden loss of a job. So this is one of the things that can happen. We actually end up with that trauma disrupting our sleep cycles. So the word is fragmented sleep, which never feels restful. And really, the more that you experience fragmented sleep, you're not getting into the deep sleep stages. And you've probably heard of this one, REM, rapid eye movement. That's when a lot of brain detox, condensing of memories, a lot happens during that stage. We do know that if you're already struggling with anxiety or depression, it probably is going to get worse with disrupted sleep. And it does make recovery even more challenging. So sleep deprivation and emotional regulation. The more we have sleep deprivation, the more it's difficult to regulate our emotions. The more we may feel irritable, impulsive. Emotions might feel out of control. We might even surprise ourselves by how reactive we might become. So we know, and again, this is why here at the Center of Place Hope, we do these sleep studies. We want to know exactly what's going on so that we can help. And you may notice as I process emotions, anger, fear, guilt, shame, as I'm processing trauma, my sleep tends to begin to progress to be more restful, more restorative, and I begin to feel different about going to sleep. All right, the role of REM, that rapid eye movement, this is where we process emotions and consolidate our memories. Disrupted REM sleep can really kind of put a cap on the brain being able to heal and heal trauma. Poor sleep, disrupted sleep, that sleep that's full of flashbacks and so unpleasant really will diminish that REM sleep. And by the way, we cycle through stage 1, 2, 3, 4, 5 is that REM sleep, and it varies, but approximately every 90 minutes we're cycling into that deep, that REM state of sleep. So, okay. sleep issues have a lot of different reasons. We know with post-traumatic stress disorder and trauma, one must address sleep issues. There's simple things. There's like we don't use technology 1 hour before bed. We always have a super dark room. No, those lights that are on everything. Don't put your cell phone in your room. Put it in the next room. If you use it for an alarm, turn it up loud and put it in the next room. So there's just certain things we always want to do. A little journal right before we go to bed. Put down for 10 minutes, maybe just writing about my concerns or emotions of the day or things that I'm worried that I would forget. Write them down just as a place to start. We do want to seek help, would be the word that's being used is trauma informed. Super important. That we're in the hands of somebody that really understands mental health and sleep issues. There is a type of cognitive behavioral therapy, and it's used a lot for helping retrain the mind for more restorative sleep and insomnia. So there are some things that we can do. And critical part of recovery from post-traumatic stress disorder is getting back into a circadian healthy rhythm cycle of our sleep. And this can be done. It might take a month or two, but we can refocus in a way that our sleep becomes more restorative. It does happen. It really does. And I know at times it feels, no, it can't happen. And I've been struggling for so long. I mean, this is why the whole person approach is so important, to get down to what are the core issues that we have to address in order for there to be restorative sleep, which also is healing for that post-traumatic stress disorder and the trauma. And this is what we do here at the Center, A Place of Hope, is that trauma-informed and the different ways of addressing trauma. I've seen it. I've seen it work. And this is why we do, you may do a sleep study at the beginning of one's treatment and towards the end. And you look at the printout and go, my goodness, I do feel better. My sleep is more restorative. So there is hope.